welcome you all to this Sunday morning online webinar. This webinar is for cardiology trainees and early cardiac electrophysiologists who are looking to shape a successful career in their field. We have excellent speakers who are going to talk about what are the opportunities in this field of cardiac electrophysiology in our country, India, and what are the opportunities abroad. This is one of its kind webinar. Please make full utilization of the opportunities here so that you get a window of what lies further ahead. Me at my early stage in my career was looking for something like this so that I can meet the people abroad and get to know what is happening in the other countries and how do I get an opportunity to work with them. But here, I present this opportunity right before you. Please make full use of this. This is the agenda of the program. First, I'm going to talk about my journey, followed by Dr. Sendil Tambidurai from the United States, and then Dr. Rajiv Pathak from Australia, and then Dr. Dibendu Kandra from the United Kingdom, London. Each of us will be talking about our journey from India to abroad for about 10 minutes, followed by another 10 minutes of a discussion between you and the speaker. We will stick to the timings, and this is a recorded presentation. And this presentation and webinar will get over in 1 hour, 20 minutes exactly. Myself and Dr. Deep Chand. Hi, Dr. Sendil. So, Sendil, sir, this is a recorded presentation and recorded webinar. We are yet to have candidates or trainees join us. It's Sunday morning, right? They are maybe probably yet to wake up from their sleep. So what we thought is we will stick to our timings. We will finish the presentation, and this presentation, our webinar will be available for people to view later on at any point of time if they want. Yeah, we had around 60 registrations. And as I told, probably Sunday morning, people are hesitating to wake up at 7:30 a.m. Probably we'll have more joining down the line. So we will stick to the timings as I mentioned. So we are already 8 minutes down into the presentation. So what I will do is I will complete my journey and then I will leave it to you to take over. Yeah. So myself, I'm Dr. Deep Chand and I'm the Director of Electrophysiology at Kaveri Hospital, Chennai. So my presentation will be in two parts: what I do as an electrophysiologist in India, and number two, how did I climb to this spot? So myself, I'm the clinical lead cardiac electrophysiology at Kaveri Hospital, Alwarpet and Vadapalni. There are 2 units in Chennai, and I take care of the EP and the pacing department. After my training abroad, we now in the last 3 years do almost all of the possible latest or state-of-the-art radio frequency ablations using 3D mapping, atrial fibrillation ablations, atrial tach ablations. We have both the NAVEX precision system and the J&J CARTO system. We are a specialist in complex VT ablations, especially the papillary muscle VT, where we have had a number of studies published on this, and epicardial VTs. India is a substrate. India is where we have a lot of the ARVCs, arrhythmogenic right ventricular cardiomyopathies. These are the patients who form most of our epicardial VT ablations. And then intracardiac echo is one of our expertise. We go around the country trying to propagate and teach many people on the use of intracardiac echo and intracardiac echo guided ablations. Leadless pacemakers at the moment, the Medtronic Micra leadless pacemakers. We go around the country proctoring many people, many electrophysiologists and the cardiologists in trying to use this very effective technology, Micra, which is the leadless pacemaker. And we have done around 50 plus leadless pacemakers so far. The other leadless pacemaker, which is in the market, which is yet to be launched in India, and of course will be launched in the next week, is the Abbott's Aveo system. We do state-of-the-art device implantation using conduction system pacing, what you call the LOT CRT, the hot CRTs, and all of those. And then we move around trying to enable cardiologists provide this therapy to their patients. There are a couple of live EP workshops they have conducted so far. This is a workshop where I take the opportunity to train the electrophysiologists in the country in the use of these latest technologies. Especially atrial fibrillation ablation, we give hands-on experience to the electrophysiologists and the early career or the EP fellows in the country in the use of left atrial mapping and the HD grid, the high density mapping, the use of intracardiac echo, and so on. This was the workshop, second workshop they had been conducted 4 months back. And as I mentioned, we go around the country doing a lot of procedures, especially 3D anatomic mapping guided procedures. That's where we in India are still catching up, because we still are used to a lot of 2D ablations, but then we go around trying to propagate this idea of 3D electroanatomical mapping guided ablations. We have international patients coming in, especially from Africa, to make use of our technologies. We have cardiology PG training programs, especially the EPACE PG track program, which was started this year. This is for the final year cardiology trainees, so that they get an exposure in the devices and in the field of electrophysiology. This is basically, we designed all this because this is something as a cardiology training I missed in my early years. And I thought as a cardiology training, one must be exposed to all these training programs in the field of electrophysiology. And whether or not you choose the field later on in your career is up to an individual's choice. But I think this exposure should start right from your cardiology training. We have the annual ECG masterclass programs conducted at Chennai. We have conducted 2 years of this ECG masterclass programs. We have excellent, fantastic teachers from around the country, and especially within the state of Tamil Nadu, come and teach ECG to the general cardiologist, and as well as to the internist and the physicians. I was a faculty at the Asia Pacific and the Indian Heart Rhythm Society national conferences. Press releases, we do make it a point to educate the public on all the latest things that we do, so that everyone is aware of the latest technologies available in this field of cardiac electrophysiology. So what made us do so much in the last 2 years or 3 years? That's where the key is. That's where I wanted to let all the young budding cardiologists and the electrophysiologists in the country, the fellows especially, to understand if you have to make a successful career or whatever you think you want to do in this field of electrophysiology, I think it is better you go through a structured training program. And if you are a person who wants to come back to our country, to settle in our country to practice, it makes sense to spend an initial 1 to 2 years, at least in our country, to understand the substrate of arrhythmias in India and get exposed to electrophysiology here. And then it is a must, according to me, to move abroad. Myself went to Australia, but you could choose your place. And then you can have 1 or 2 years or 3 years of training there. And then once you come back, I think you will be a complete package where you will be exposed to the substrate of arrhythmias, both in the country and what is happening abroad. And you will be equipped to do all the latest that is available and provide what is the latest to our own people. So to the second part of the presentation, how do I reach here? So let me tell my journey, and then so that this opens up a few arenas for the people who are watching this. Yes, Australia is where I did much is my abroad exposure. I completed my PhD, higher degree research program in the Australian National University. I'm telling this here because, as far as Australia is concerned, they appreciate people getting into the country once you're committed to a research program. So once you're committed to a research program like a PhD, which is a 3-year program, or a 2-year MPhil or the master's program, where you have a 2-year clinical registration. You will be given hands-on in your 2-year clinical registration. If you have completed your graduations from India, you are allowed to do that. So 2 to 2.5 years of clinical registration is maximum that you can have as a international medical graduate from India. You can make use of this opportunity to do your clinical fellowship program, and alongside you can do some research activities as well. So the mode of entry into Australia is mostly you getting committed to a research program, either the 2-year program or a 3-year program. Along with, you will be definitely awarded a 2-year clinical electrophysiology clinical program as well, where you will have hands-on exposure. And that's the path that I took. This 3-year program helps because you are automatically given a work visa for your family, which means your wife will be able to work. And then your students will be given free education in the 3-year period. So they will be going to the public schools, which are fantastic schools there. So which in this part of the career, your children, if they will be in the early part, like in their primary, and it makes sense for them to get exposed to what is going on abroad as well. And more important, the education system is free of cost if you are committed to a research program. During my research program, it is not an easy task when you combine research along with clinicals, because you are committed to doing studies. You will have to take time out. You'll have to spend your weekends doing the research and your weekdays doing the clinics. But then that's how it is. So this is during my program, I completed around 10 publications, 4 to 5 original articles. All of them eventually helped in completion of the PhD program. When you Google Scholar Me, the most important article or the study that we were part of was the Kepler trial, where we did the pulmonary vein isolation plus the posterior wall isolation. We were a center which contributed to these patients in Australia. It was a multi-center randomized controlled trial. Apart from this, if you look at the structure of my publications, the first initial publications came from our country, India. It is important to know this because this is what led me to go abroad. So once you have publications in India, I'm not talking about case reports, I'm talking about original articles. And if you're having your original articles published in our country, be it in the Indian Heart Journal, that's fine. It's a good journal. And then that will build up your resume, your CV, and that makes you a better candidate to be chosen for a higher degree research program in the Australia. Because the higher degree research program come with a lot of fees involved, but if you have to need your fees to be waived, your resume has to be very strong. So the initial 1 to 2 year of your basic training in India, you can utilize that opportunity to build your publications, post your DM or your DNB, and then you can slowly start trying to build your resume and start applying for universities abroad. And that's when you get the grants. I got my grants and the fee waived from the Australian National University. That was because my resume was some sort of an okay for the things. And then during my research program, of course, I had a lot of publications done. And the academic work, as far as an electrophysiologist is concerned, never stops. It goes on. And still now I spend time trying to take time out of some weekend hours, trying to do some publications, be it some case reports of original articles. This is the clinical electrophysiology fellowship program that I had in Australia from the Australian National University, along with Professor Rajiv Pathak there. And then it was a wonderful stay of 2.5 years and good hands-on exposure in the labs there. It's good to know. And of course, as I mentioned, this is family time in Australia. Family is along with you. So 3 years, the family is funded. You have your fees waived. You have a minimum guarantee salary structure there. and then which you can definitely meet your ends there, and then you should be able to have a comfortable family life for 3 years if you are chosen for a research program. So that's the story. That's my story. What I would emphasize here, everyone works hard, but passion with focus is what will take you abroad, or will take you forward in your career. Patient resilience is going to be very important in this field of electrophysiology. Whatever, even at this point of time, I feel do not have enough patience. People call me a patient guy, but I never think that I have enough patience. It just keeps building. India and abroad experience always helps. You will hear it directly from our speakers from now on. Clinics and academics both have to go along with in this field of career, in this field of electrophysiology.